Welcome to Emergency Chaos, where we provide tips and tricks to make you a better ER nurse. Today, we're keeping it simple. We're going over common conditions you're going to see in the ER. My hope is that if you do not know at least the basics, which include what it is, how it presents, treatments, and complications, that you take the time to educate yourself so you can become a better and safer nurse. Common cardiac conditions that you should familiarize yourself with include STEMIs and NSTEMIs, CHF exacerbation, ACLS and all of the rhythms listed, hypertensive emergencies, cardiopulmonary arrest, and the other conditions listed. Do know that the list of conditions you'll see in the ER is massive. I just want to go over some of the important ones that I believe new ER nurses should be aware of. For respiratory conditions, we have pulmonary embolisms, asthma and COPD exacerbations, pneumonia, ARDS and pulmonary edema, pneumo and hemothorax, drowning, and carbon monoxide poisoning. Next is shock. Take the time to familiarize yourself with each of the types, which include anaphylactic, cardiogenic, obstructive, septic, hypovolemic, and neurogenic shock. As for neuro conditions, we listed strokes, which include hemorrhagic and ischemic strokes. Also get familiar with all the different types of brain bleeds, seizures, Bell's palsy, the different types of headaches, meningitis, and encephalitis. With GI, we have GI bleeds, cholecystitis, and gallstones, mesenteric ischemia, bowel obstructions, pancreatitis, liver failure and cirrhosis, appendicitis, GERD, swallowed foreign bodies, and peritonitis. Next, we have ectopic pregnancy, ovarian and testicular torsion, eclampsia and preeclampsia, placental abruption, pelvic inflammatory disease. Then there's also renal failure and dialysis, acute kidney injury, nephrolithiasis, pyelonephritis, STIs, UTIs, and priapism. Here, I just wanted to list some of the other important conditions that you should take the time to familiarize yourself with. These include DKA, hypoglycemia, suicidal and homicidal ideation, cancer complications, sickle cell crisis, alcohol withdrawal, and delirium tremens. So, of course, as I said, please take the time to familiarize yourself with each of these conditions. Again, you're going to be a better and safer nurse for it. Thank you for joining us. Thank you for your time today. I hope that I was at least able to teach you one thing. If you want to keep learning, I've listed my favorite ER nursing related books in the description, with my favorite being Sheehy's and the Case Files. As well, please take the time to watch my other videos. Also, if you would like to help support the channel, I have nursing stickers and shirts on Redbubble that you can check out again. Thank you for your time today. And as always, teamwork makes the dream work, and here at Emergency Chaos, we are proactive, not reactive.